What's up, Easy fam? Welcome back to the channel, guys. Welcome back to another video on ASCP vlogs. If this is your first time tuning in, you're highly welcome to my channel. Please do well to like, comment, subscribe, turn on your post notifications so that you're notified when next I drop another post. Also, don't forget to check out my playlist, ASCP Preparatory Guide, that will lead you on everything you need to know about the ASCP exam, from account creation down to paying and booking for your exam. And without further ado, let's get into the content of today. So today, guys, we'll be talking about ABO discrepancies, and I know you'll be wondering, why should I stick till the end of this video? I mean, I've read ABO discrepancies and I'm done and dusted with that. Well, the tips I'll be giving out in this video is something that you have never heard anywhere before, and these are actually strategies that I made use of while studying for my own exam, and these strategies actually helped me on the day of my own exam. So on my own exam date, I think I had about 6 questions about ABO discrepancies, and this method that I'm going to be, these different tips or like this information that I'll be dropping in this video was what I made use of. And yeah, I basically, aced it up in the exam, and I would really want to share these tips with you guys. So towards the end of this video, I would also be dropping important points to note regarding ABO and everything concerning ABO. I would also be dropping 5 questions, guys, 5 practice questions, high yield practice questions that would give you a good insight on what they expect from you on that day of the ASCP exam when it comes to ABO blood group discrepancies. Without further ado, let's get into the video. We are going to first of all start with defining for the forward and then the reverse grouping. In the forward grouping, we are identifying the unknown antigen in a known antisera. So we all do this every day in our labs. I want to believe that everybody watching my video is a medical laboratory technician or a medical laboratory scientist. So it's like your normal ABO blood grouping. You take your antisera and then the patient's blood, and you want to determine the antigen present in the red cells against the antibody present in the antisera. And then agglutination in A means A pause, or if it's agglutinates indeed, then that's A positive, B positive, and vice versa, and all of that. But in the reverse grouping, the reverse is the case. Now, in the reverse grouping, you have red cells that have a known antigen, but you have a serum that has an unknown antibody. So you are typing a known antigen against an unknown antibody. So in the case of forward grouping, where the antigen is in the red blood cell, and when you see agglutination in A and then in D as well, that's A positive. But in reverse grouping, the reverse is the case. So if you see an agglutination in A and the red blood cell, that, let me say you have B cells, and you put a drop of B cells in a serum, and then it's has agglutination, that means that cell you're typing for is actually A. So if it's actually the opposite, And forward grouping is that you are looking for the presence of A and B antigen in an unknown red cell, but whereas in reverse grouping, you are looking for an unknown antibody using a known antigen cell. So I don't know if that explains it, or if I have to go into details. Let me say you forward type it. It's an A positive cell, A pos, right? The reverse group would show an agglutination in B, right? If you forward type it, there will be agglutination in A, but if you reverse type it, there will be agglutination in B. So if it's agglutinating in forward grouping in A cells, it is not supposed to agglutinate in reverse grouping in the A cells. It will agglutinate in B. So if the antigen is antigen B, if the person has antibody B, like poles don't attract, but unlike poles attract. So if the antigen in the red cell is B, that means the antibody in the serum is supposed to be A, because unlike poles attract. So that's why you have that. If it agglutinates in forward grouping in cell A, it will agglutinate in reverse grouping in cell B. So, right, I hope we all understand that. So now, guys, here is the important part that you really need to know, and these points will help you with your ABO blood group discrepancies. You need to know the problems with the forward grouping and the problems with the reverse grouping. If you do not know the problems with these different groupings, when you are presented on that day with a table on concerning ABO discrepancies, you wouldn't be able to, come up with an answer, because first of all, you do not even know what the problems, attributed to that particular grouping is. So now, there are, at least the one I know, 6 or rather 5 problems with the forward grouping. And these are the problems that one can, encounter with forward grouping. It can either be a Rolex formation, there can be an acquired B antigen, there can be a weak antigen, there can be polyagglutination, and then there can be an extra antigen. So I'll go over that again. It can be a Rolex formation, it can be polyagglutination, it can also be a weak antigen, it can be an extra antigen, and then finally, it can be an acquired B antigen. So these are the problems with forward grouping. So let's move on to the problems with reverse grouping. Now, the problems with reverse grouping, we also have that it can be a missing antibody, it can be a weak antibody, it can be an unexpected antibody, and then it can be what? A Rolex formation. So these are the 4 problems that can happen in a reverse grouping system. So now that we have that out and done with, let's move on to the next part of this, lecture. All this that I just mentioned forms the bedrock of ABO discrepancies. Once you know these problems with forward grouping, and then you also know the problems with the reverse grouping, I feel that there is no case about ABO discrepancy that they bring to you that you would find it difficult to conquer. There are also points that you need to know, off head. There are some things that you just need to know, and those things I will be saying it right now. So first of all, you have to know that there is something called an elution, and I said it in my previous video. So an elution happens when there has already been a transfusion reaction and there has already been attachment of antibody to the antigen. So in the case of an elution, what you do is that you elute the antibody from the antigen. Let me say this is the antigen, this is the antibody holding on to it. So in elution method, you elute the antibody from the antigen and then study it differently in an antibody panel or whatever. So in an elution case, because I think I got that question in my exam, and they said something about a transfusion reaction happened or something along that line, and then they said what to do next. And the moment that I saw that a transfusion reaction had already occurred, then we don't need to start looking for antibody in Sokoto when what we are looking for is already attached to the red cells. So I picked what's elution method. Elute the antibody from the red cells and then study it in an antibody panel. Another point that you need to know is that the A blood group has subgroups. We have the A1, the A2, you have the I think A intermediate, you have A3, and then others, but this 4 is just to mention a few. A1, A2, A3, A intermediate. I don't know if there's AX, A Bantu. There's a way I remember this in the exam, but I can't quite recall. So you need to know that A has what? Subgroups, the subgroups of A. Another point is that people with subgroup of A can produce something they call anti-A1, antibodies against what? A1. And when we move forward to practice questions, you would get to understand what I mean better when we get there. So now there's something called anti-A1, and this is produced by, all these other subgroups of A. So they kind of react to a cell that has what? A1, so an A1 cell. If you want to detect a subgroup of A, you need to use what they call polyclonal anti-AB. So polyclonal anti-AB will detect a subgroup of A. Guys, remember, polyclonal anti-AB. So this polyclonal anti-AB will bring about what? Agglutination of the subgroups of A. Finally, another point to note, another very important point to note is that A3 cells produce a mixed field with anti-A, polyclonal anti-A and polyclonal anti-AB. Guys, this point is very important because sometimes you are given a table, right? And then you see something like MF, because they don't write it like mixed field, they just say like MF. Once you see an MF, and then you look at the way the panel is, you read it and everything. Personally, what I would suspect is what? An A3 cell, because it's only A3 cells that do what? Show a mixed field with polyclonal anti-A and anti-AB. These points that I'm dropping would help you with your ABO discrepancies on that day of the exam when you are given a table and you are asked to solve different blood group discrepancies. So don't do away with these points that I'm dropping because they are very, very, very important. With that being said, let's then move forward to practical examples on ABO discrepancies. So question number 1, we have this table. So if we take a look at this table, we can see that we have a 4+ reaction in anti-A, a 4+ reaction in anti-B. In A cells, no reaction, that's the 0. B cells, no reaction. D antigen, no reaction. D control, no reaction. Screen cells, no reaction. So if we are asked to read this and solve the discrepancy, the answer I would give is that another point that I failed to mention is that when you are testing and you come across any what they call it, negative cell, like AB negative, B negative, A negative, O negative, whatever the negative is, you run D control, and your D control is supposed to be positive, right? So if your D control is negative, then there is a problem. So in this case, we have our D control as negative, no reaction. So my answer to this question is that I would say you perform a D testing as D control is negative. Let's move on to question number 2. In question number 2, we have 4 pluses with 4+ reaction, anti-B with no reaction, A cells with 1+ reaction, and B cells with 3+ reaction. The forward grouping we can see is okay, but there is a problem with this reverse grouping. And if we go to our problems, let's recap our problems with reverse grouping. We are talking about an extra antigen, a reverse grouping, sorry. We are talking about Rolox formation, unexpected antibody, a weak antibody, a missing antibody. So in this case, what I would say is that there is a weak antibody. I would say it's a weak antibody because normally from this forward grouping, we are seeing a 4+ reaction. And the B cells is showing enough reaction, just not enough because of these A cells that have a 1+ reaction. So this table is supposed to read for an A positive individual, and the reverse grouping is, agreeing with it, except for that the fact that there is a reaction in the A cells. And I said something about subgroups of A. And subgroup of A produces what? Anti-A, right? And that's why we have a 1+ reaction. So in this case, I would suspect that there is a subgroup of A because what? This person might be producing anti-A cells, anti-A1 cells. So I would say we should test for what? A1 cells in this case. I don't know if you understand the breakdown of what I just said. So from the forward grouping, we can see it's a 4+ reaction. That's a complete reaction, guys. In the reverse grouping, we have the B cells with 3+ reaction, except for the A cells that now has a 1+ reaction. I would say there is no problem with the reverse grouping, but there is a reaction in the A cells. And then we said something according to our problems with the reverse grouping. We said what? Unexpected antibody or a weak antibody. So in this case, I would say there is a weak antibody, and that weak antibody and it's occurring in where? In the A cells. I would say there is a weak antibody, and if there's a weak antibody, we are suspecting what? That there is a subgroup of A. Remember the points that I mentioned, that A has subgroups, and other subgroups of A produce antibodies against A1 cells. We are supposed to test this sample for A1 cells, as we are what? Suspecting a subgroup or an anti-A1 produced by this certain individual. Let's move on to the third question. The third question shows a table. We have anti-A, 4+ reaction. We have anti-B, no reaction. A cells, no reaction. B cells, no reaction. Okay, according to our forward grouping, there's no problem with the forward grouping. We can see a 4+ reaction. But let's go to the reverse grouping. The reverse grouping is showing a no reaction and no reaction. Judging from the forward grouping, this person is probably an A individual. So we are expecting to have a reaction in the B cells, but the B cells is showing no reaction. So let's go back to our problems with a reverse grouping, and we would see unexpected antibody, weak antibody, missing antibody. So in this case, I would say this individual is missing an antibody, and I will classify this individual as what? An immunodeficient person, because this person is lacking what? The antibody. So there is a missing antibody in this case. So do you understand why I said earlier on that you need to know the problems with the forward and the reverse grouping for you to be able to solve ABO discrepancies? That is very important. So if you want to go back in this video and understand the problems and memorize them, please do well and go back to it. So let's move on to question 4. Question 4 says anti-A1 has 4+ reaction, anti-B 4+ reaction, A cells 2+ reaction, B cells 2+ reaction. So if we look at this case, we can see that the forward grouping seems to not have a problem. The reaction is complete on both sides. So maybe this person is actually an AB individual. So if this person is an AB individual, an AB person, the A and B cells that is showing a 2+ reaction and a 2+ reaction is not supposed to be there, because if you are an AB individual, meaning that you have antigen A and antigen B, so your antibody is not supposed to be there. The antibody against A and B is not supposed to be there. So but there is a reaction in those two cells. So in this case, let's go back to our problems with a reverse grouping, and then we have the Rolux formation, unexpected antibody, weak antibody, missing antibody. So in this case, I would say it's a Rolux formation, and if you have to deal with a Rolux formation, what you have to do is what? To wash the red cells. So I would say, I forgot to also add that as part of the points that you need to take note of. When you have a Rolux formation, you wash the cells. So I would say it's probably a Rolux formation, so you need to wash the cells with what? Saline. So let's move on to question 5, which is the last but not the least. We have that anti-A has a 3+ reaction, anti-B has a 1+ reaction, A cells has no reaction, B cells has a 4+ reaction. Now from the reverse grouping, we can see that there is no problem, and this person seems to be an A individual. But from the forward grouping, we can see that the reaction in A is sufficient, but there is a reaction in B, a 1+ reaction. And if that means we are looking at what? A problem with the forward grouping. So let's move backwards to where we recorded the problems with the forward grouping. We have an extra antigen, a weak antigen, polyagglutination, Rolux, and an acquired B phenotype. So in this case now, guys, we have that anti-A has 3 positive reactions, anti-B has a 1+ reaction. So it's safe to say that this individual may have acquired a B antigen. So I would choose an acquired B antigen in this case, because if we look at the reverse grouping seems not to have an issue, but the forward grouping has the issue, and the issue lies mainly with the 1+ reaction in anti-B. And if we go backward to our problems with forward grouping, we have that we have problems with an acquired B antigen. So in this case, I would say that the problem with this table is an acquired B antigen. So with that, I hope you guys have been able to understand the ABO discrepancies, know how to apply the problems with the forward and the reverse grouping, know how to apply it to the table, know how to apply it to your questions, as well as the tips I gave earlier on in the videos. The tips I gave earlier on in the video, you know how to make use of it, and fit it into your questions and fit it into your ABO discrepancies. I had about 6 questions about ABO discrepancies, so you shouldn't sit out on this technique. And trust me guys, if you make use of this technique, you would find yourself, acing anything ABO discrepancy. All you need to know is your problem with your ABO grouping, with your forward grouping, your problem with your reverse grouping, as well as those tips I mentioned earlier on in the video, and also within the whole process of explaining this lecture. And with that being said, we've come to the end of this video. Please don't forget to like, comment, subscribe, turn on your post notifications so that you're notified when next I drop another video, and I'll see you in my next video.